using the old card, right? So old card, so why? Because like old card gives us like a line of reference and we're not forgetting to ask questions. That's why. Is that clear? All right, so, and then always, when you're taking a pain history, you have to quantify it. You have to say, the patient complains of pain and describes pain to be 10 over 10. Okay, he took 2 Tylenol and then it was only alleviated with minimum success, and the patient was 9 over 10, and then finally he came to the hospital. Is that clear? So kind of you have to quantify it so a provider can understand how intense the pain was, and then the Tylenol only brought it down only 1 level, and so still it was unbearable for the reason the patient came. And that way you can kind of quantify also whether the intervention was successful or not, right? So you're giving medication, the medication is only bringing down 9 over 10, it means that wasn't successful. So this patient needs more intense medication. All right, so the next thing is, okay, so this is the old card. I kind of explained it. Okay. All right, so definitely people who are in pain, they're not going to be in a good mood, so their morale is not going to be up, and they're going to be very much irritable. All right, so somebody who is in pain, they're going to be less tolerant. They're going to be agitated. Are they going to be talking to you like in a good mood? No, like they're going to be agitated, right? And then so they're also, what are they doing? They're guarding. What is guarding mean? So like, so this is guarding. Is that clear? So like, like you're kind of, you don't talk to me, like, like I'm in my own little world, right? So for physically, that physical expression, it tells you a message that this patient is in pain. Is that clear? So, and so like this is like usually during labor, and then so like what do they say, like all these deep breathing exercises, right? So imaging. So does that mean that like the pain physiologically is changing? No, but like you are transporting yourself to another level not to feel it. Does that make sense? You're distracting yourself, but the pain is there. So for this, like, use imaging. What is imaging? I went to Hawaii, like everything was beautiful. So like it was so peaceful. Like I come back to Los Angeles, I have to remember what I saw, and then the brain doesn't recognize whether like you're in Hawaii or you're in Los Angeles. It gives the same peaceful effect on you. Does that make sense? So that is called imagery. All right, so people use that as a technique to distract you from the real situation that you're going through. Am I making sense? Yeah, okay. So medications, so there are opioids, anxiolytics, non-steroidal anti-inflammatory drugs that I said it. These are non-prescription medication. You take it over the counter. And then as far as children, so with the children, you need the mother, right? Why? Because in every house, they describe pain in a different language, So some houses they say ouch, some houses they say boo boo, So like in other words, so you don't know like what do they use. The mother knows what the child says, and then so the mother is a better translator because they have communicated with the child before in the house. Am I making sense? And so like you also, you're gonna be seeing the facial expressions, also grimacing, protective posture, so guarding. And so one time like I'm asking, so Chris, like what's your pain? And then so he pointed. Oh, so where are we? Okay, we go back. Okay, so I said like, where is your pain? And then he puts here. And then I say, why did you say 4? Because he's 4 years old. So ask like, why did you say 4? Okay. So like the number 4 is important to that child. So, okay, so we said this. And then so we kind of said that the older adults, they have chronic diseases like diabetes. So obviously what do they have? Like diabetic neuropathy, fibromyalgia. What is the fibromyalgia? The same thing, what fibromyalgia is. You see on the commercial. So it's also like it is from the motor pathway. Haphazardly, the brain is sending all these messages to the muscle, and then the muscle is hurting. So there isn't any like diagnostic test that you do it and then you can find out, oh, this person has fibromyalgia. The provider has to kind of clinically diagnose it. What is clinical diagnosis?
By symptoms?
By symptoms, and then the provider has to use their own experience to come to a conclusion. Does that make sense? There is no test that shows that, oh, I did this test, now like, okay, it shows that you have fibromyalgia. For that reason, like there are trigger points, and then so like they're gonna say, okay, does it hurt here? Okay, does it hurt here? Does it hurt here? So in other words, those are the trigger points, and then so that's how the provider, because of his experience, and then because like whatever the patient says, they come to a conclusion without any lab test. So what is that called? Clinical diagnosis. Is this clear? All right. So rheumatoid arthritis, osteoarthritis. With rheumatoid arthritis, it's an autoimmune disease. So what's happening that the body is attacking its own joints. Is that clear? So for that reason, the joints are like the synovial fluid. There is inflammatory process. And what do you see? Like a lot of swelling, You see like the knee is like, oh, like what is this? It's like a bumpy knee. All right, because there is a lot of swelling there because it's ongoing inflammatory process. Is that clear? So that's the rheumatoid arthritis. And osteoarthritis is like systemic because it's autoimmune. It can affect all the joints. So whereas in this person, when they wake up in the morning, how are they? They're stiff. Every joint is swollen. They're stiff. Because it's autoimmune, it's systemic. Does that make sense? So the osteoarthritis, if somebody's like a tennis player. So which joint they're kind of overusing? The right shoulder, right? So for that reason, the cartilage there, it is worn out. And then every time there is an activity, the pain is more. But when they're resting, there is no pain because like the activity aggravates the pain. Is that clear? Okay, so this is osteoarthritis. Okay, so neuropathy, we kind of talked about it. Okay, so, all right, so if you have a patient who cannot express about their pain, so the family member has to kind of be translator because if she's crying all the time, the family member knows that the patient is in pain. Is that clear? Okay, we talked about the old card. Okay, and then also like if there is pain, so how is the vital signs? Okay, the heart rate is high and then the blood pressure is high. Okay, so people are diaphoretic. Okay, so these are like how you're gonna be describing. These are the words that you're gonna be using. So like with the MI, so how is the pain? The stabbing pain to the chest that radiates to the left shoulder, to the left neck, to the left jaw. Do you see? All right, and then so with the diabetic neuropathy, it's tingling, numbness, burning, and pricking. Okay, so every time like you see like the electric shock, or like there is the pain, there is like an electricity. So what is it? It's neuropathic pain. So what is neuropathic pain? Neuropathic pain is the one that comes out of the brain to the muscle and it hurts without the sensory pathway. Did I make sense? That's a neuropathic pain.
Can I ask you, for MIs for women, aren't they different?
It is different. So like till the 90s, it wasn't known. So women were going to the hospital and then so I have indigestion, and they were given the proton pump inhibitors, they were sent home, they were going home and then they were dying. All right, so why? Because like they presented as a gastric symptom. I have indigestion. If you only give me 7-Up, I can drink the 7-Up and then, like I will feel better. But then what happened that, okay, the 7-Up, it can be gastric, but it can be MI, angina also, that can lead into MI. All right, so for that reason, if the patient, now it's the rule, when they come with the gastric pain, so cardiac enzymes have to be checked also.
You said neuropathic is just efferent?
Efferent, yeah, efferent. Okay, so these are all, so post-herpetic neuralgia, somebody said the shingles, that's post-herpetic neuralgia. Diabetic neuropathy I explained. trigeminal neuralgia and reticulopathy. This is trigeminal neuralgia. It's also motor pathway. Has anybody had an experience with trigeminal neuralgia? I had the experience, so like I had gone, usually they say that like when you have a dental work, all right, so the trigeminal nerve is irritated. All right, so the trigeminal nerve, cranial nerve number 5, it's responsible for the jaw movement. Okay, all these movements that we do with the jaw, we do it because of the cranial nerve number 5 motor. Is that clear? So I come home, and then there is this pain out of nowhere. Like there is pain on your tooth and then I'm jumping out of nowhere. Like how do you translate it? So like what happened? So usually they say that like when you have a dental work and if the trigeminal nerve is irritated because of the dental work, like it goes crazy and then like, it's kind of stimulated and it's kind of, but I went to my dentist, she didn't know. She said, okay, you just irrigated, whatever, like, and I'm coming. So then I'm calling my mother and then my mother says, so like I'm born in Lebanon, so like in Lebanon, have you heard about arak? It's like the drink of the country. So like it's clear, but like when you add water, it becomes white. Have you seen it? No. All right. So that everybody has it like in the house because it's the country's drink. Does that make sense? So it's also used like if you have pain, like we drink it also. Like it's kind of a home remedy. But like it's people drink it, like everybody has it in their house, right? So it's you drink it with, you don't have to drink it with dinner, but like people drink it. Or if you don't drink it, at least if there is pain, like menstrual pain or any pain, like we drink it. Okay. So and then my mom says, okay, take the cotton, dump it with the arak and then put it on your tooth because like it's gonna numb it and you feel better. So why there is truth in it because what is that alcohol gonna do? It's gonna numb the sensory pathway so that the pain doesn't reach to the brain as excruciating, so that the brain is not gonna be translating as excruciating. What is that doing? The alcohol is numbing the sensory nerves. Am I making sense? So if the sensory nerve is numb, it's not going to be actively transporting all these messages to the brain. So the brain doesn't translate it as excruciating. The same concept as Oragel, right? Oragel, the baby is teething. Why the baby is crying? Because the tooth is breaking the gum to come out. So obviously that's a tissue injury, right? It's going to hurt and the baby is going to cry. So what is the mother going to do? Put Oragel. So Oragel is, what is it doing? It's numbing the sensory nerves so that the message doesn't go to the brain as excruciating, so the baby is not going to cry. Am I making sense? So like, I'm putting this arak, but still like I'm jumping. Why? Because the trigeminal neuralgia, it is like this, the motor nerve is like, it's coming from the brain, from the motor nerve to the muscle, and I'm hurting. So in other words, numbing the sensory pathway is not going to be helping because the problem is that the brain is sending from the motor pathway to the muscle. Am I making sense? So like I drank the whole bottle, still like the pain didn't go away. And then I had to go to another dentist, like he had to do another diagnostic test. He said, this is trigeminal neuralgia, you have to take anti-convulsive. So then like I go to my primary care physician, then she gave me the anticonvulsive, then the pain went away. Is that clear? So trigeminal neuralgia, it is the motor, the brain is sending the messages from the motor pathway to the muscle, and then for that reason you're hurting. So taking Tylenol, putting alcohol, it's not going to help because the problem is not the sensory pathway. Am I making sense, guys?
Mm-hmm.
Is that chronic or?
No, luckily.
Okay.
Luckily, people are chronic. There are people who are chronic. But luckily I overcame. I don't know where it came from, but like I really experienced it. Okay, yeah, okay. Okay guys, like now I'm gonna talk a little bit mental health. So as much as I talk fast, still like look at me, like this is connected to this and I'm doing my what's this? My laptop. Okay, let's go.
I'm at 5%. Can I?
Are you enjoying the class? Yeah. All right, so let's do the mental health.
7.
Yeah, no, 7. The status, sorry. Oh. Oh, 56 slides. Oh, because part of it is the lab. Part of it is the lab. All right, but like the lab, we don't do it here. Like those slides, we do it in the lab. I did separate it because it's going to be too many slide decks. Yeah, so don't be scared, so like the slide deck can be big, but physical exam part of the slide deck is done in the lab. Is that clear, guys? Okay, yalla, let's do it. So mental status, what is mental status? Obviously, our cognition. So, but then also the mental status is not the only cognition, our behavior too. Do you agree? Like if somebody's going with pajamas to bones. Okay, so like what's the mental status? Or like, barefoot. I mean, you know what? I'm not seeing people barefoot anymore. Like, I think rules change, right? So like no shoes, no service, no shirt, no service. Okay. Like it was high time, really. So, yeah. Huh? So it was high time, my God, yeah. So, all right. So in other words, that kind of reflects the mental status also. Does that make sense? Okay, so. And then so like, so I have this lady, I mean, she came to church and she's going to get the communion. All right, so like, is this like a dress or a blouse? So I'm looking, is this a dress or a blouse? All right, so it's short, and then, like I'm gonna get the communion. All right, so how does that work? So like the key is, okay, so I'm not gonna be judged or anything, so does that make sense? Like every place has its appropriate attire, right? So let's face it, so like we can kind of put together some clothes together that is gonna be appropriate to that occasion, all right? So anyway, so that's mental status.
So her mental status not
Yeah, say it again.
the woman, her mental status not.
Yeah, I mean, like I'm not judging or anything, but like, so, like, I mean, as an adult, we have to distinguish, like what is appropriate here. So for that reason, I want everybody in a lab attire because like if I'm going to demonstrate, so this is lab. I mean, I know it's a class and it's a lab together. Like there isn't, I mean, a wall between the two, right? I can demonstrate here or I can teach during the lab. So it's kind of, we have to be as a student, right? So today I didn't put my earrings. Did you notice? Yeah. Because it's lab. Yeah, so, so like, I have to be a good example also. Like, we have to respect our roles, right? So today we're in a lab. Okay, lab doesn't need like, okay, big earrings. Okay, so another day that I'm not in the lab, okay, I can change my attire. Okay, so that's all under mental status, in other words. Okay, so, okay. All right, so the brain is only about 2% of a person's body mass, but requires about 20% of oxygen and calories. So a lot of blood has to go to the brain. Is that clear, guys? Because the brain needs like the sugar to burn it for energy to work. All right, so it cannot burn it cannot burn fat for energy. It needs to. So the blood has to be there to nourish that brain so that the brain can do its work as far as processing, the thought process. Okay, so now, when we look to the anatomy and physiology, so what do we have here? We have the forebrain, and then we have the hindbrain, and then we have the midbrain. So which one is the bigger part? The forebrain. So what is the other name of the forebrain? Okay, cerebrum. Very good. So then we have the midbrain and then the hindbrain. What is the other name of the hindbrain? Cerebellum. Okay, very good. Okay, so always remember that like all the heart functions, okay, are done by the forebrain. All right, so if you're going to be doing mathematics, arithmetic, so if you're going to be, when you're taking a test and then so you have like to concentrate, to memorize, to remember all these advanced functions, it has to be done by the forebrain. Okay, so the hindbrain, the cerebellum, so what is the function? Balance and coordination. Balance and coordination. The only reason we are like standing up and we have an erect posture because we have the cerebellum. Is that clear? All right. So if we didn't have cerebellum, so like how are we going to be walking? Four-legged. All right. So balance, coordination, gait is erect, and then I'm walking with no limping or anything. So because of the cerebellum. Is that clear? And the other thing about the cerebellum is that any primary functions that we do, it's because of the cerebellum. All right, so like what are the primary functions? Okay, breathing, okay, sleeping, like yawning. So all these things that the animals do and we do, it's because of the cerebellum. Is that clear? Anything beyond the primitive functions that we do, it's because of the cerebrum. Did I make the difference? Okay, very good. Okay, now, so now like the cerebrum is the bigger part, so it is divided into 4 lobes. Okay, so we have the frontal lobe, which is the red one, and then so the frontal lobe, so what is it responsible for?
Higher functioning,
Say it again.
cognitive functioning,
What functioning?
like problem solving,
Problem solving, okay.
all your cognitive faculties.
Yeah, all like advanced cognitive function, like concentration, critical thinking is done with the frontal lobe. So for that reason, like when you're taking a test, what part of your head is you're holding? Your forehead, right? Okay, you hold your forehead. So it's like, okay, so you want like the help of your forehead because all that advanced concentration and then critical thinking is done with the frontal lobe. And then what else as far as memory? Short term. Short term. Where did you park your car? Short term memory is the frontal lobe. Okay, so do you lose it? I mean, sometimes, like, I park somewhere, then I remember, like, was it like Wednesday that I park here or it's Thursday that I park here? So you have to remember, like, because if every day you park somewhere, like, you have to kind of put the extra effort to remember where. Was it Wednesday? Was it Thursday? Okay, so that's the frontal lobe, all right? So, and then the other thing about the language. So, in the frontal lobe, we have the Broca center. What is Broca center? So the words that you put together to compose a sentence that is appropriate to that specific occasion. Does that make sense? So in other words, when you're talking to me, what do you tell me? You're telling me Dr. Nakashian, right? So you don't call me with my first name. Why? Because the Broca Center tells you that, okay, as a student, like we have to respect our teachers because we learned, and then we have to use the title. Does that make sense? The same thing with the priest. Like, every priest has like their own title or their religious people. So like you have to use because you just cannot call people by their first name because it's not proper. Is that clear, guys? So the Broca tells you like what title to use with what person. Okay, so this is the frontal lobe. Parietal lobe, I think. Parietal lobe. So the parietal lobe is p. So what is p? Perception of stimuli, pain, proprioception, body position, movement. All right. So the parietal lobe. Okay. So if you're sewing your the button on your uniform, like your uniform doesn't have button, okay, so, or lab coat, and then you prick. Okay, so you prick your finger, right? So the sensory pathway, it's going to take it to the brain to translate it as noxious stimuli. So when you prick your finger, do you laugh or do you cry? You cry, right? Because it's not pleasant, right? So where does the message go in the brain? To the parietal lobe. Does that make sense? So what is the parietal lobe going to say? All right, so this stimulus that I got, it's not pleasant, cry. Or like throw it away, right? So, okay, so that's what, like it translates the pain, yes.
Is it only for pain?
It's, no, like also proprioception too. What is proprioception? So in other words, like let's say that there is this, like, there is a stairs here, like this much stairs, and I'm gonna go down the stairs, and the stairs doesn't have rails. All right, so how do I go down? Do I like jump? Okay, let me jump and then go to this. I will fall, right? Because, there is no rails. So how am I gonna go like this? Like the other step, right? And I'm touching the wall. Why? because I know that like in any other position, it's going to be dangerous and I'm going to hurt myself. Does that make sense, guys? So proprioception. So like in other words, your position in accordance to the situation. Am I making sense? All right, so that's what like the parietal lobe does. All right, so a lot of time, you know, so like now with my little granddaughter, like, okay, so be careful because like if you get up fast, you're gonna hit because she's playing under the table. Does that make sense? So that's the parietal lobe. Okay, so how do I get out of the table before hitting my head? We have done it, right? A lot of time we hit ourselves because like we didn't pay attention. Does that make sense? Mm-hmm. Yeah. So that's the parietal lobe. Temporal lobe is like temporal lobe, like here, the lobe that is close to your ear. All right. So in other words, like because it's close to the ear, so there is the Wernicke center there. Wernicke center. So what is Wernicke center? So like you hear me, you understand, and then you perform. Does that make sense? So in other words, the hearing and understanding. Is that clear? So that's the Wernicke center. Okay. So all right, so like I told you, like, okay, all of you are going to be wearing uniforms, so like you understood, and then you do it. And then I say, like, you know, you have to be here at 8 because like the quiz has to start exactly at 8, and everybody was here before 8. Does that make sense? So you hear me, you understand me, and then you change behavior. Am I making sense, guys? Otherwise, like, who wants to be here at 8, really? So like, okay, everybody wants to be, I mean, you know, take your time. But rules are rules. For that reason, we are civilized. Does that make sense? Otherwise, like if there is no structure, there is going to be more chaos. Do you agree? So for that reason, so this is the temporal lobe that I said it, you understood, and you performed. Is that clear? All right. So, and then occipital lobe, it's easy. It's vision. It's here. It's at the back, and it's only responsible for vision. Okay. So limbic system is for emotions. Okay. If you're happy, like you're blushing, okay, so because like you're excited, that's the limbic system. Okay, and then the reticular activating system is in the brainstem, regulates level of wakefulness or arousal. Disruption of ascending reticular activating system can lead to altered mental status. So where is it? Oh, it's in the brainstem. Okay, review of related history. Okay, older adults. Okay, guys, now, so when you see a patient who has Alzheimer's, okay, by the way, the big term is dementia. Alzheimer's is like part of dementia. The big umbrella is dementia. Does that make sense? Alzheimer's is a disease of dementia. 60% of dementia patients have Alzheimer's. So for that reason, it is like used interchangeably, but dementia is bigger umbrella. Alzheimer's is like one disease of the dementia. Is that clear? Okay. So, and then so when you see Alzheimer's, which is like another, it's a disease under the umbrella of dementia, what is the first thing the patient's family notices?
They start forgetting.
They forget. I mean, you know, well, a lot of time, what do you hear on the news? They go out, they're lost. They're living in that street for 40 years. They go to the stop sign. They look right, they look left. Where am I? And they're lost. And then so the family puts like all this announcements so that this patient has been lost. Did you see this patient? Like bring them home. I mean, they can be in their own vicinity and they're lost, right? So they don't remember. So what happens that with the Alzheimer's, the frontal lobe is affected. Is that clear? So what happens that like, you know, like it affects all these nerves that like they were going to bring nourishment to the frontal lobe, they're all blackened, and then so they're all tangled, and then no blood is coming, no nourishment is coming. So this frontal lobe is suffering. In other words, for that reason they don't remember, and then so they don't remember that they put the stove on. It's dangerous because they can burn the house, you know. So anyway, like that's my bad. Behavior also, because like I put the food on and then I go upstairs and I forget, I come down, you know, like you know, so that's a bad behavior too. Like, okay, so for that reason I said, you know, every time like I have to go upstairs, I have to turn it off because I get distracted and I forget, right? But like the frontal lobe is affected. So for a reason they forget, and then also their short-term memory is affected. So the other thing that the studies have suggested, a lot of time. So when you go to the patient, and then you say, all right, so what was your name? Genevieve. Okay, hello. How do you do?
I'm good.
Okay, so I'm your nurse. I'm gonna be taking care of you. Okay, so now like Genevieve, like probably she didn't. I mean, I'm telling her that I'm your nurse. How do you do? And then she will respond me, "Thank you. I'm well. How do you do?" But not necessarily she's responding me. You know, like, okay, Genevieve, like she has been a teacher for 50 years. She's always like shaking hands, like with the administrators, with the parents, right? So she remembers that shaking hands is the civil thing to do. And then so because like she felt my hand, and then because I said something and she kind of repeated, not necessarily knowing who I am. Does that make sense? So, and then because like it was the civil thing to do, and then you did it for 50 years, you kind of repeat the same thing. I'm well, thank you. How do you do? But like not necessarily you're responding me. Does that make sense?
It's a condition.
It's conditioned. The patient has been conditioned. So for that reason, the studies have shown that the higher the education level of the person, so like, you know, they're going to be responding to you due to condition rather than knowing the real state of time. So for that reason, like patients can fool you, in other words. So for that reason, you have to go even further to make sure that there isn't any problem as far as the frontal lobe. Am I making sense? So because like they had done research on the nuns were in the convent, and then they were doing their work. You know, they were going in the morning they were doing their prayers, they were reading the rosary, and then they go to the farm, everything they were doing. And then when they died, they opened, so the frontal lobe, it was all like tangled. So like they were doing out of conditioning. And then they were functional. Does that make sense? So for that reason, you know, like even if it's going to happen, so for that reason, what do they tell you? Go take a new course. Do like puzzles, right? So because like you have to impose the frontal lobe to be active, even though physiologically it's deteriorating. Am I making sense? All right, so these are like, we're gonna be doing this in the lab, all right, so patient number 1, so that's, okay, because I have only 5 minutes. So we'll do this in the lab. Examination and findings. Okay, let me tell you what is this. Okay, so in the cognitive abilities, all right, so mini mental status is a tool. I want you to look for it. You know, I used this when I was working at St. Joseph Rehab, and then not only the nurses use this tool, recreation therapists use it, social workers use it. It's like a questionnaire, and it has 30 points. Is that clear? So what is your name? Where are you? And then there is like, you know, there is a house. You have to draw the house, and then there is a clock, and then you have to put the numbers like 1 o'clock, 2 o'clock, 3 o'clock on the face of the clock. And then there is one question, it says, okay, fold the paper and give it to me. And then one question says, close your eyes, you know. So it's very simple. Everybody uses it, and it's 30 points. Does that make sense? If you get 30, it means that your mental status is good. And then so like I don't remember obviously the ranges. So from this range to this range, there is like a mild mental status diminished. So from this score to this score, moderate. From this score to very bad mental status. Is that clear, guys? Mm-hmm. So in other words, it's a quick way to assess like how is your mental status. I mean, you don't have to go to psychiatrists to do it. Everybody can do it. Does that make sense? So in other words, like it's an initial screening. Obviously, like if there is then they have to go to psychiatrists for if they have Alzheimer's. It's bigger questionnaires. Is that clear? So mini cog, it is like, it's part of the mini mental status. It's shorter. All right. So, and then we can use this like in the clinical setting. This is widely used. Okay. I've used it a lot. Okay, because I work in rehab. Okay, one thing that I'm going to be telling about this, and I'm going to conclude the class. All right, so remember, like, you know, if there is a CBA, what is CBA? Cerebrovascular accident. What is the other word? A stroke. Right, very good. Okay, so now if there is a stroke, All right, so there is the right hemisphere and there is the left hemisphere, right? So if the stroke is on the left hemisphere, everything you learned in kindergarten, it wipes away. So what did you learn in kindergarten, Bethany? ABC. Okay, numbers. ABC. Right. You like 1 + 1 is 2, right? Okay, so all these simple things that you learned, it's on the left side. And then so if the stroke is on the left side, it goes away. So for that reason, you see stroke patients, they see the speech therapist. What are they learning? With the flashcards like A, apple, B, boy, C, cat. They have to relearn. Obviously, it's going to be faster because like it comes back because of the conditioning. Does that make sense? So they have to go back and learn, So I saw one patient when I was taking the students to Rancho Los Amigos in Downey County Hospital, and he was a librarian. This guy didn't marry. Like, he read and read and read, and he made his own little library, and then he was renting or giving books away. He was like very devoted to reading. No family, nothing. He's only reading. And then he's distributing the books and then keeping a track, bring it back. I give it to you, then I get it from you. And then, so he made a life. And now like he has a stroke on the left side. And then he said, all the readings I did all my life is wiped away. So like all my wealth is gone. Does that make sense? So anyway, still I can see his face. Anyway. So he was ready to read all these books again. And then, so on the right side, if it happens, so then, remember, right art. So think about artists. How are the artists? Artists can be emotional. So like they have to be inspired to draw, to sing, right? So in other words, they're more emotional. If the stroke happened on the right side, and then you come and say, all right, so how are you doing today? Okay, so Genevieve, Miss Genevieve, how are you doing? And you start crying. And then I'm the nurse. I'm surprised. Like, what did I tell you? I said, Miss Genevieve, how are you today? And then you cry. Why? Because the stroke is on the right side. Does that make sense? She becomes emotional, but that had nothing to do with you. So the nurse is like, okay, that's not something personal. And then the other day, I said, Mrs. Genevieve, how are you? Go away! You kind of scream because like you're irritated, okay, impulsive. And then, so what did I tell you? Like I told you, like, how are you today? Like I'm going to bring you water. Do you want water? And you're screaming. And then it didn't match, my talking to you, your response to me, it's not matching. It's not you and it's not me. It's the disease. Does that make sense, guys? So for that reason, you have to be very considerate when you're taking care of stroke patients because it's not in their hand. There is an injury in the brain. Okay?
Do similar things happen, like when there's a brain injury or concussion?
Yes, that's closed head injury, and then that happens like when they are in accidents because like with those what is that thing?
Motorcycles?
Yeah, it's the other name. Yeah, AT. So, like that was a fashion in the 80s, and then I was working in rehab. A lot of head injury. Is it a fashion still? That thing? Is it still fashion? Oh, okay, yeah. So I don't know. So I don't keep track. But that was very much fashionable thing to do as a recreation. A lot of people, close head injury, they're coming. You look from outside, everything is nice. And then when they're talking, they're aggressive, they're crying. You cannot control, they're irrational because there is close head injury. Does that make sense, guys? Okay, let me tell one more thing about a stroke. One more thing, then I'm going to conclude the class. So when you have a patient that the stroke is on the frontal lobe, okay, so the frontal lobe, what was there as far as speech? Which center? Broca. Broca center is like responsible to put the sentences together so that you can address the person. So if it's gone, so what are you doing? You see your patient, they can't put the words together. They become aphasic, and then so they know they want to talk, but like they cannot find the word to put together to be expressive. Does that make sense? And so that's where the frontal lobe. So for a reason, like you see the stroke patients, they're kind of, you have to give these patients like a whiteboard, they have to write it, or like you have to communicate with flashcards. And then, it doesn't only happen to old people, young people can have too, a stroke. I mean, anyway, so, and then the other thing is like if it's in the temporal lobe, so what center was there? Wernicke. Wernicke is what is responsible. You hear me, you understand, and then you do. And then I come and say, all right, so give me your spoon so I can feed you, or. And then so they look, and then so they see this highlighter, and then she gives me the highlighter. So she heard me a spoon, but she understood as a highlighter. This is the closest she can get to. And then so like you wonder, like I told you a spoon, but you're giving me the highlighter. So you can't say that because that's the Wernicke Center. It's kind of damaged. That's how much she understood. Does that make sense? All right, so the class is dismissed. All right. Okay, peace on you guys. All right, so I hope that this was like productive. So I'll tell the instructors to do a little bit of the mental status also.